and सभी गुरुजनों को सादर प्रणाम. So today my topic is conclusion on different types of Bala, but in fact there are 4 types of Bala which were already everybody knows. Bala Chatushtay has been described in our Samhitas, not in some Samhitas, only 3 varieties were described. Later on in our Nigantus, Bala Chatushtay has been described. I'm not going in detail about the description and detailed textual information about the Bala species, which are described very elaborately and intensely in our text. And there are a lot of information is available, so that I am directly going to the clinical application based on its gunakarmas of each Bala varieties, so that we can confirm its Rasaguna Vira Vipaka, and there is a lot of scope in clinical application. So first I would like to go Cytocardifolia. This is the Cytocardifolia, everyone knows, and there is no controversy, and this is an established and it is an accepted species. So this is Cytocardifolia. And regarding the Cytocardifolia and the Bala varieties, one important and very significant feature of this Bala guna is Bala Ojo Vardayatyapi. This is a very important and very significant and clinically very useful gunakarma of this Bala. So this has Bala Ojo is described in Dhanvantari Jigan, but Kayadeva Nigantu, in addition to Bala Ojo, he also added Dhatu Ojo Bala Ayu. He has also maybe because out of his clinical experience, he also added Dhatu Vardhanam also. So based on this feature, I have given this Bala. I really wonder, I really surprised see the results, clinical implication of this Bala in post-COVID lethargy. You may be knowing second and third, mostly in second wave, post-COVID survivals are very high. They have survived, but most of them, 70 to 80% of the patients were suffering from severe lethargy. Really a wonderful use in post-COVID lethargy. We have given whole plant of Bala, dried Bala Kashaya we have given in 50 ml doses. We prepared hundreds of liters every day, and we have distributed freely to the patients, whoever comes to our clinic. More than 100 patients per day, we have given this Kashaya, 50 to 100 ml based on their strength and lethargy levels, intensity of the lethargy and their age. And even for small kids also, we have given this for 3 to 5 days. And surprisingly, 3 to 5 days, and this lethargy greatly reduced in all patients. So that is a wonderful clinical experience of me. And second one is cancer fatigue. You may be knowing, though they are receiving, the patients who are receiving mostly chemotherapy or radiotherapy, they really say fatigue is a shrama, what we call is a shrama. Shramo Bina Vyaparena, that is a feature of the fatigue. Without doing any physical activity, feeling tiredness is a fatigue. This will very bothersome problem for the cancer patients, though they are receiving the oral chemo or radiation. This problem will be very disturbing and disgusting to the patients. The same Bala, Cytocardifolia, Moola Kashayam we have not. We didn't take this whole plant. Particularly, we have taken the root Kashayam and continuously given for 3 months. And most of the patients who received this medicine, really they feel very energetic, and they didn't feel the side effects of the chemotherapy. Now also few patients, I think it's 8 to 10 patients already receiving this medicine. This is wonderful, and every practitioner can use this one. But my sincere request is to collect yourself. Don't buy don't purchase outside. For yourself, go to the field and just see where it is abundantly available. Just collect the root, and if it is possible, collect in a good nakshatra. That is a Pushya nakshatra. What I collected in the day. And regarding this Atibala, there are actually two varieties of Atibala. One is big and one is small. The big one is named as Aptuline Income, whereas the second one is named as Aptuline Income. Both can be taken as Atibala as per my personal experience. And Abutilan hirtam is not abundant than the Abutilan indicum. So Abutilan indicum is very much abundantly available than any other Bala species. It is available throughout the year, and everywhere it is available throughout India. It is available, very cost effective, and very effective in various clinical conditions. Let me just give some of the examples where I have used this Atibala in different forms. Even Atibala Mula, Atibala Patra, Atibala seeds, Kangi seed, all parts of the this Atibala is useful in different clinical condition. It is one of my favorite drug. I will be having presently मेरे पास 200 to 300 kg bala mula वात चूर्ण रहता है, हर हमेशा भी रहता है. So more in every month I will distribute more than 100 kgs. So this is one of the favorite and result oriented medicine hai, and very cost effective also, very cheap and easily available. And this is Aptuline Indicum. Everybody knows. I need not to explain the morphological features about the Aptuline Indicum. It is accepted. Atibala is accepted as Aptuline Indicum. There is no doubt. And Aptuline hirtam in some of the southern places. Aptuline hirtam is also available, and it is also having the same clinical features, the clinical effects. And it's just a little variation will be there in the fruit morphology and the flower morphology. So this is the mild variation different between this one. First one is Aptuline Indicum flower, and the second one is Aptuline hirtam flower. And in our area, southern area, particularly in Hyderabad and surrounding areas, Aptuline Indicum is very much available. So we use this one. So one of my really wonderful clinical feature, stricture urethra. So actually it has told Bala Mula Tvacha Churna Pitam Sakshira Sharkaram in Mutra Krucha Roga. It has told that Bala Mula Tvacha Churna has to be taken with milk and sugar, but we have used it in different way. So stricture you may be knowing, and the bulbar stricture, maybe urethral stricture, maybe there may be stricture in different parts of the urethra. And there are different grades of this stricture also. First to third grade of urethral stricture, it is very useful. And how to use means, so one is internal use, Atibala Mula Kashaya 50 ml. So it has to be either Chaturbhaga Kashaya or Ashtabhaga Kashaya. And we have to add Ela Churna 3 grams and Sita 10 grams as Prakshepa. And one more important is Uttaravasti. In some of the patients, if you go on giving internally this Kashaya, if you do not get results, you just go for the Uttaravasti, or directly you can go to Uttaravasti without giving internal Kashaya. So for Uttaravasti, you have to take 10 ml of 21 Avartita Atibala Taila. So instead of Sida cordifolia, we are using Atibala for the preparation of Bala Taila. So you had to add 1 or 2 grams of the Sinol. You had to mix this oil very well. You have to take it into the 10 ml or 20 ml syringe. Leave the उसका needle निकाल के urethral orifice में वो टिप लगा के थोड़ा उसको अंदर घुसाना पड़ता है. You have to insert the oil slowly within 5 to 8 minutes of gap. Sometimes if the stricture is a third grade, entire oil will come out. You may be knowing, you will able to know the stricture is obstructing the oil inflow, so that next day also you have to give. Like that, if you go on giving every day or alternate days, within 5 to 7 sittings, the stricture will go and the this oil flow will be inside, so that we can be able to know that the stricture is gone. So the stricture urethra is very troublesome to the patient. Very pain will be there, and uh, it is a surgical case. And if you go to the neurologist, they directly suggest the uh, stricture repair. Uh, and there will be some other treatments also available, but very easily with a very simple technique, Bala-Thaila will cure. I really challenge these cases. It can be curable with this Bala-Thaila Uttaravasti. Within 5 to 7 sittings, the stricture will go. I have more than, I think it is 14 cases I have treated so far. It's a very wonderful way of giving the Bala-Thaila. And next one is osteoarthritis. You may be knowing osteoarthritis is very troublesome problem. And this, each and every practitioner will face the osteoarthritis cases, minimum of 5 to 10 cases per day. Mostly 300 cases of the osteoarthritis will be there in almost every practitioner of Ayurveda. And different yogas are being used. Sometimes they may get the result, sometimes may not. But over the last 3.5 years, I'm using Atibala seed powder. So Atibala Bija Churna. And it is also very effective in grade 1, grade 2 osteoarthritis only. And when the arthritis developed to grade 3 and grade 4, and there is no cartilage left over, there is a minimal cartilage, and there is a moderate cartilage is present, and this is also moderate. There is no tibial spiking. Here you can see some sclerosis of the end plate. So these up to 2nd grade, the condition can be reversed with the Kangi beach. So these also I will collect personally in the summer season, when April to June, end of the June, these seeds are very much available. It's the best time to collect. And while after collecting, the very important thing is regarding the powdering. So when we pound it, the outer shell will be very hard. This percentage of the shell of the seed is very more. You can get very little quantity of original kernel powder. Out of 1 kg, you can only get 300 grams of the real kernel powder. That is very effective in the clinical usage, in particularly osteoarthritis. So you must you have to really note this point. So whole powder, if you take 1 kg powder and you don't try to make it 1 kg powder out of the 1 kg seeds. When we are sieving, शांते सब क्या है, वो नीचे में थोड़ा सफेद आता. So after 3 or 4 series, so you don't get whitish powder, you get only black powder. Then stop the sieving and they collect the white powder. That is useful. So that white powder only will get 300 grams per 1 kg. I use that one, and remaining will be thrown out. So that is not useful. That is the hard shell of the seed. And this can be given 4 to 6 grams with equal quantity of Sita Churna if a patient is not a diabetic. If a patient is a diabetic, don't add Sita Churna. Instead, you can add Jeera powder, half of the quantity to the Kangi beach. And after that, there are other options of Abhyanga and Januvasti with Atibala Thaila. The Thaila, Bala-Thaila is prepared out of Atibala Moolam, particularly, not whole plant. And one unfortunate thing is I have to mention here that almost every company which are selling the Bala-Thaila, they are not using Bala Mula at all. No, even reputed company, I don't mention the name, reputed company, whoever we are having the trust, they are not using Bala-Thaila. If you use the Bala or Bala, any other Bala, Moolam alone, not using the whole plant, the consistency and color of the oil will not be like the company Bala. It will be some smoky and whitish in color. So that is the important thing to be noted. So that only has to be used, and it has tremendous results as Januvasti, and you can also use for the Abhyanga, and also Abhyantar Sevana 5 ml or 1 to 2 teaspoons can be given on empty stomach with adding with half cup of warm milk for continuously. You have to give minimum of 3 months, and you can continue till the patient get results. And after the 3 months, patients in severe condition, grade 2 condition, patients start getting results, more pain relief without any painkillers and other supplements and other medicines. 30 to 60% of pain relief there I have seen. I have been treating more than 50 to 60 cases presently, and all are receiving these medicines and they are very happy. So this is very useful in clinical condition. And one of the most very important and challenging clinical condition is diabetic peripheral neuropathy. There is no medicine in allopathy. This is very serious complication in diabetic patients. So I've been treating diabetic peripheral neuropathy with Atibala Mula Kashayam for last few months only. I started using this condition few months, just three months or more than 3 months, 3 months plus. So wonderfully, I'm getting the results. The pain, burning sensation, and tingling sensation, and needle pricking sensation, and most of the patients 20 to 30% reduction have seen. So in diabetic retinopathy, 20 to 30% of reduction is really a great achievement. So this is the Atibala Mula Vata Churnam, which I have collected and made it into Vata Churnam. So it will be having more fiber, so that it cannot powdered, cannot be coarse powdered. So it will be remain like this. How much you grind it, how much you try to powder it. This is the this will be there. So in that peripheral neuropathy, diabetic peripheral Atibala Mulak Vata 50 ml with 5 grams Jeera Churna as prakshepa, and empty stomach daily morning once. So it's wonderful drug, and I'm getting very promising results. And one most important clinical condition which we encounter in our practice is cervical spondylosis. So it will associated with vertigo, cervical spasm, with or without osteoporosis. If you see the cervical spondylosis is X-ray, you can see some of the osteophyte formation there on the end plate surface of the vertebra. So that will bothersome. It may cause root compression, may not cause root compression. Its pain will be severe. Even with the little movement of turning of the neck, the patient feel giddiness or pain or other problem. So in this condition, and other condition is also brachial neuralgia, where there is a narrow root compression. This is a severe brachial narrow root compression. So in both these conditions, Atibala Chaturbhaga Kashaya, 50 ml with 2 grams of Saindhavala. So this reference we can get in Yoga Ratnakara and in Apabahuka Chikitsa. We adapted this taking as cervical spondylosis and brachial neuralgia as Apabahuka. We have used. Actually, this is a very common prescription for me every day. Will be there. I will be having more than 100 packets. Each is having 300 grams daily. 10 grams of the Vata Churna has to be taken, and you can add water on the Chaturbha Kasham taken, and Saindhavala 2 grams morning on the empty stomach. So, and also you can use Atibala Taila Nasya, and Murdupaka can be used as Nasya, and Karapaka used as Abhyanga. And instead of Bala, I've been using Atibala. And also in degenerative disc conditions. So this is also very commonest challenging cases in our clinical practice. There is a sciatica, there may not be sciatica, and it will be bothersome problem in old age people, and over the time the thinning of the disc will be there and the degeneration will be there, and because of degeneration this may slip outside and may cause neural foramina compression or root compression. So in these conditions we can use in different ways. Instead of using Pseudocardifolia, I've been using Kshira Bala Tailam prepared with Atibala. And the internal, it can be used in internal external. Used in the degenerative disc, as we can use it as an Kativasti form and Tailavasti, Snehavasti, 30 to 60 ml per day. So if patient allows, patient is cooperative, you can use Matravasti 40 ml every day. Every day you can give for about 2 to 3 months continuously. If you give, you can get wonderful result. And also Abhyantara Snehapana 10 ml, as I mentioned earlier, can be taken. And one more thing, and an important thing is Aligospermia. It is called Russia. So why you can't use it in this condition? I use this one, and it can be very effective in Aligospermia, Asthenospermia, and more importantly, varicocele grade 1 to 4. I have treated grade 4 varicocele, and that has came down to grade 1. This is a wonderful achievement, and it's clearly a surgical case. If you go and show to any surgeon, it's only you have to go for this surgery. There is no other way. There is no other option. Even some of the Ayurvedic doctors also suggest to go for the surgery in this condition. And but we can use this Atibala Tailam in different form. And this is the, actually I have treated one case. So this is the testicular size is also increased with Atibala as Matravasti, and Atibala Kangi Bija Churna internally with Sita Churna equal parts in milk for 3 months, almost 3 months, I think. So you can see so both testicular small in size. The testicular size is very small here. So other is left varicocele grade 4. So here you can see left grade 1 varicocele, and there is a normal testicular size. There is no mention of smaller testicle. This is a wonderful achievement with the Bala, and we have used this as Uttaravasti. I have given to the patient itself, and I trained him to take this every day. So just 2 to 3 ml, as I earlier mentioned, with the syringe without needle. I have to insert to the urethral orifice, push oil inside, and hold it for few minutes, and let it come out. And how much the quantity it will come, it has to be wiped out. So this has to be continued for 3 days, and as I already told, Kangi Bija Churna, 5 grams, I think. 5 grams have given. This is wonderful. This is a clear surgical case. This patient has been to more than 4 surgeons, and everybody told that it is a surgical case. You must go for surgery. The patient is not willing for the surgery. If you want a natural way of pregnancy. And this is the same case. He's having, because of the small testicles, there is all the parameters of the semen have increased greatly. So you can see the 16 billions, and here is only 10 millions sperm concentration. And motility increased, and normal forms increased, abnormal forms decreased, and the live sperms also 77% increased. It's only 64%, and dead cells are only 23, and before that is 36. And there is a normojuicepermia, has clearly mentioned here, and earlier before this oligoasthenojuicepermia. It's a wonderful treatment. So only with Kangi Bija Churna and Kangi Mula Tailam. So that is the importance of Mula when we give, when we prepare. And don't use any Bala Taila outside. If possible, use it. If not possible, don't use it. And one more very important and very useful clinical application. Premature ejaculation. This is also very challenging clinical encounter for every Ayurveda practitioner. So I have really got good result, not excellent result, but considerable result in premature ejaculation. 5 grams can be churna with 5 grams in Gopika, 10 grams in Sita churna for 3 months or 4 months till the patient gets satisfactory results. But I cannot say, but it is a sure medicine, sure application, but it can be used, and along with other medicines also it can be used. And this also in very effective in PCOD. The most very commonest clinical cases encountered in every Ayurveda practitioner's clinic. So we have to use 7 or 21 avarti Atibala Taila, Mula Taila. We have to use only Mula while preparing the Atibala. Every time I have been mentioning don't take whole black. So can be even 10 ml internally, and very simply Yoni Pichidar, and you have to dip cotton. So Yoni Pichidar for daily night time, that can be within 3 months the PCOD will come. And this is the reports the patient who have received the same treatment. So it's a polycystic ovaries. So here it is a sonographic abnormal, no sonographic significant sonographic abnormality in pelvis. Right ovary is normal, left ovary is normal. Here is right ovary, both ovaries predominantly peripheral distribution of the follicles. So this wonderful present. And this is again Nagabala, and as Grivia has, and it is also having very excellent clinical application. And this is the Nagabala Mulatvak. I have collected this one, and one important thing is it will a strip जैसा आ जाता है. आप उखाड़े तो निकाले तो लॉन्ग स्ट्रिप ऐसा ही आ जाता है, टूटना कभी बीच में टूटता है. So this will be a single strip of the Atibala Mula. So from the mid of the stem to the end of the root, we have taken this one. It will be more than 2 to 3 meters. I have rolled it out, and how to use it is very important. So इसको थोड़ा थोड़ा छोटा छोटा pieces करना है. We have to make it into small pieces, and we have to pieces करना है. So उसको वो pieces को थोड़ा मर्दन करके थोड़ा you have to grind it and soak in 100 ml of water in the during the night, and the next day morning you have to squeeze with the pieces within the water, so there will be a gel formation. So after the gel formation, वो pieces को निकाल के वो छान के उसमें अगर जरूरत पड़े तो शक्कर, नहीं तो जीरा पाउडर डाल के पी लेना है. So this will be very useful in most of the urinary tract infection, stubborn urinary tract infection. Almost patients will come to us even they're not responding to the any latest antibiotics. All the resistance has come to the most of the antibiotics. So they will come to us, and this is the one of the best choice. But even the same can be used in spermatoria also. It is also very useful. And this is another variety Nagabala. It also Sida caudate also has been taken as the Nagabala. And in clinical, I have used it in inflammatory arthritis. It's also very commonest, like the gouty arthritis, rheumatoid arthritis, reactive arthritis. There are so many inflammatory arthritis out there. Either metabolic reasons or autoimmune reasons. There may be inflammation in joints, small or big joints, and multiple joints or bilateral joints one side. So there are different forms of arthritis come across in clinical practice, and particularly in rheumatoid arthritis, where the active inflammation is there. So there is maybe stiffness and hotness and very shooting pain will be there. In that conditions, along with the regular medicines, if the patient receiving allopathy medicine, let them receive. Take if the patient is taking Ayurvedic medicine to Ayurvedic medicine or together or both Ayurvedic or allopathy medicines, if they are taking, without stopping them, you just add this Sida cordata, fresh leaves. It is only useful in fresh form. If dry leaf powder is not useful, I have seen clinically, there's no much difference. There is no use. I did not see much effect in dry form. So that it will be available only in the rainy season. So if it is available everywhere also. So kalka of the 20 to 30 fresh leaves with 2 grams of maricha churna. Maricha churna you can add and give it. It will be given every day in the morning. Or else fresh plant, whole plant kashaya can be also given in 50 ml dose 3 or 4 times according to the patient pain severity and inflammation severity. And this kalka can also be applied. Fresh leaf kalka can also applied on the joint swellings also, and the patient will get relief within 10 days. And let the patient continue other medicines if the active inflammation come down. And if it is needed, if whenever the active inflammation bothers, again you can start. I have seen so many cases very useful in clinical. This is a Sida cordata. Everybody knows this one. And Sida rambifolia as Mahabala. It is also used to be seeds, the fruits. Fruits can be used in some of the clinical conditions like migraine. So these fruits, the fresh fruits are to be collected, ripened fruits to be collected, and they have to be dried in shade, and you have to make it into powder, and that powder can be used as nasya in migraine, and within 10-15 the pain will be subsided if it is a vataja shirashuddha. So it's also very useful. So these are some of the, so there are so many species, Sida species are being taken as Bala Sida, Sida spinosa, Sida albifolia, Sida retusa. There are so many. I don't want to discuss on that because I don't have any clinical experience, personal clinical experience of those other species of the Bala varieties. So these are my clinically experienced Bala species. Thank you. Thank you, everyone. So,
Venugopal sir, I just wanted to know, have you tried any of these preparations, especially Nagbala in cystitis?
not cystitis, but urinary tract infections, which are such stubborn. Urinary tract, of course, it will come. Even urinary tract infection, sometimes it may turn into cystitis also. You can give Nagabala as a Grevia hirsuta, particularly root kachal and root
Kachal. You
kachal.
soak it in water and the next
Yes. It will.
How many times?
When you squeeze it, it will morning on empty stomach.
Okay.
So it will be very coolant. So Shita Virya, no? Madhura, Shita Virya, Pishchila, Balya, Brumhana, Rasayana, all properties are there.
So basically in cystitis, the bladder gets affected. So, the bladder needs a little healing. Yeah. So I will try that. Thank you very much.
Even not only in cystitis, of course, it's a very, very common, but in ulcerative colitis also. Yes, I have used Atibala Mula Kashaya plain alone, not adding any other Taila, Madhu or any other Kalkas. Just giving the 600 to 800 ml Atibala Chaturbhaga Kashaya. I have used in ulcerative colitis with wonderful results. Wonderful results.
Great, great. That's nice. Thank you so much, sir. Thank you.
रश्मि श्रीवास्तव जी।
हेलो, नमस्कार सर। लेक्चर बहुत ही इंफॉर्मेटिव था सर, लेकिन एक क्वेरी है कि सीडा रोम्बिफोलिया जिसको महाबला आप बता रहे हैं, तो उसके जो पिक है वो सीडा एक्यूटा का है, तो क्या रोम्बिफोलिया और एक्यूटा सेम है?
Sida
क्योंकि हमें जो मालूम है कि रोम्बिफोलिया रोम्बॉइड लीव्स होते हैं।
No. See, just a little clarification I would like to give. So when you are an academician, so almost our focus will be go to a specific species of Mahabala. But as a clinician, so what I suggest, when you try to uproot the plant, which is not easily uprooted, cannot be uprooted, that is Mahabala, irrespective of species or whatever you call. Maybe it is Spinosa, Rambifolia, or Acuta, whichever it may be. All are Mahabala only because the strength of the roots will such that one cannot uproot. Even once the ground is dried, it's very difficult to uproot the plants. So that much strength will be there in the roots. And whereas the nearby plant can be uprooted very easily, the same within inches distance, if the Atibala is there, Mahabala is there, it cannot be uprooted. So you try which plant, either Acuta, Rambifolia, Rhomboidea. They looks somewhat similarly. If you try to uproot, if it is not coming easily, you just consider take as a Mahabala. That's all.
Okay, sir. Thank you, sir. Thank you, sir, so much.
Don't go behind the species.
Okay, sir.
In clinical condition, with respect of the name of the disease, you just don't bother about the name of the disease. If you just assume, if you analyze the dosha conditions, if Vata Pitta patient is the Vata Pitta condition, Vata Pitta disorder is there, just give Atibala. Just give Atibala, irrespective of the name of the disease. Don't go behind the any case, either it is rheumatoid arthritis, osteoarthritis, or ulcerative colitis, or even if you wonder, I really forgot to mention about wonderful results in autoimmune thyroiditis, that is Hashimoto's thyroiditis, where this anti-TPO antibodies and anti-TGO antibodies will be very high, and it is very difficult, and there is no cure, and there is actually there is no medicine in allopathy. I have given 3 cases, and the 3 cases within 6 months. It took long time, but 6 months anti-TPO antibodies come to half. The patient is having 700, and after 6 months, the anti-TPO antibodies will came down to almost 300, 150, like that. 300, half of the values I achieved. And even TSH levels, which was 16 in that patient, and without any additional thyroxine supplements. So the patient is under control within normal limits. Actually, I forgot to mention that case. So very wonderful in autoimmune disorders, inflammatory or non-inflammatory arthritis, and the neuromuscular disorders. Okay. Particularly whenever you
SLE conditions.
Huh?
In SLE conditions, are you tried, sir?
Yeah, no, I didn't try it, but you can. I already told, if you feel it is a Vata Pitta case and compromised immunity case, because it is this is one of the means a special quality is there. This Ojo Vardaka, I don't think I have seen any other plant or dravya which is having Ojo Vardaka clearly mentioned, directly mentioned. And I request my gurus will explain, they will tell, give a clarification about the Ojo Vardaka of the any drug as mentioned anywhere in our text. So I think only Atibala Bala only has the Ojo Vardaka, Palyojo Vardaka, and Dhatu Vardaka also. That's the reason I have selected giving in degenerative joint disorders and degenerative neurological disorders like osteoarthritis and neuropathy and all pathy symptoms.
Sir, one question is asked in chat box. Can we cultivate the Atibala? If yes, then which kind of soil and environment required for that?
It is suitable in any kind of environment, any kind of soil. That is the beauty of this plant. It will grow like a weed plant in many parts of the India. It is almost available every part of the India, every part, each and every part of the India. It doesn't require even watering, nothing. It requires. It don't get pest even. It doesn't get pest even. I have not seen a single pest on single plant in my lifetime. No plant had infected with any pest so far. I have seen.
Can we use the post-COVID colitis? Atibala can be used in post-COVID colitis, sir?
Definitely. Whenever, wherever in the body and whichever in the condition, there is an inflammation. You just directly give Bala, Adibala, directly, irrespective of the part of the body. Even I have given in the this, diabetic retinopathy also.
Sir, we cannot think about the Rasaguna Vipaka because Bala is a Madhur Sheet. And
Yes. And if you feel there is a Vata Pitta disorder is there, Vata Pitta condition is there, Vikuti is there, then you directly can go as Charaka said, Vata Pitta Prashamanam. So Bala is Vata Pitta Prashamanam. Directly go Atibala. I think among all the Balas, my favorite is Atibala because it is available everywhere and throughout year it is available. And you need not to spend much money, and it grow like a weed, and it has tremendous results also. And one important thing is after procuring, don't keep roots as such because it will attract some कीड़ा लगता है. 15 दिन में सीड़ा लगता है. You just directly make it into Vata Churna and you can store it for long time also.
अतिबला का पंचांग यूज करते हैं हम लोग. उसमें 1 चम्मच पाउडर लेना, 15 से 20 उड़द के दाल रात में पानी में भिगो के रखना, सुबह उसको बॉईल करके छान के उसमें 2 चिटकी सेंधा नमक डाल के देना. तो ये पूरे सर्विकल स्पॉन्डिलाइटिस, लंबर स्पॉन्डिलाइटिस में बहुत अच्छा काम करता है सर. और ये अपना सहस्त्र योग बोल के जो केरला का किताब है उसका फार्मूला है, ये डायरेक्ट रेफरेंस है अपने पास उसका, बलादि कषाय बोल के. तो हम लोग अतिबला यूज करते हैं सर, उसमें बहुत वंडरफुल रिजल्ट आ रहे हैं. और एक दूसरा सर बहुत अच्छा एक रेफरेंस मेरे को सहस्त्र योग का है सर ये रेफरेंस. और एक बला के पत्ते सर, हम लोग सब जने बला मूल बोलते हैं, लेकिन बला के पत्ते के भी बहुत अच्छे यूजेस है. मुख्य रूप से उसके जो ताजे पत्ते रहते हैं, रात में खाना खाने के पहले अगर 5-6 पत्ते अपन चबा के खा लेंगे और उसके बाद खाना खाना सर, तो कॉन्स्टिपेशन के लिए बहुत अच्छा काम करता सर. क्यों बोलते उसमें पूरा जो लीफ में म्यूसिलेज बहुत अच्छा रहता, तो ब्यूटीफुल मोशन फ्री आता. और जो क्रॉनिक पाइल्स पेशेंट है उसमें वो पत्ता बहुत अच्छा काम करता सर. ये 2-3 पत्तों के बारे में मेरा एक्सपीरियंस है सर, बहुत अच्छा काम करता. अतिबला का पत्ता.
नमस्ते सर.
You are audible.
यस यस सर, नमस्ते सर.
नमस्ते.
एक पूछना था कि इनमें से जो साइडा वैरायटीज आपने दिखाए ना, कौन सी वैरायटी आपको ज्यादा चिकनी ऐसे स्टिकी मालूम हुई? क्योंकि चिकना जो उसका एक नाम है ना.
Yes. This one Grevia hirsuta.
Okay.
Grevia hirsuta is a more mucilaginous nature. So see, if you what you do is you just take a fistful of coarse powder of Grevia hirsuta root into the bowl and add some water and you squeeze it. And you remove that water. Again, you add some water and squeeze it. Again, it will become gelatinous. So that it can be done more than 6 to 7 times. That many times it will go on giving mucilaginous nature. 7 times you can get the mucilaginous. Each time adding fresh water.
Okay, sir. So Grevia hirsuta may be the one of the drug of choice.
Yes, madam.
In case of other Sida species.
Yes. For Pischilla guna is more. than any other species, as per my observation.
Okay, sir. And what about trumpetta, sir? Because
Trumpetta,
sometimes market trumpetta roots also. Yeah, trumpetta panchang also in the name of Bala.
Yeah, there are all are what do you call substitutes, and the triumpheta is there, and the Urena lobata is there, and even retusa is also as adulterant. I can say all these are adulterants. This cannot be taken as substitutes or alternatives to all these four varieties of balas.
Okay. So इनकी एक्टिविटी ये साइडा और ग्रेविया के तुलनात्मक कम ही है
Yes,
clinically.
yes, yes.
Yeah. Okay. Okay. Thank you, sir. Thank you.
Even Urena lobata whole plant is also means being sold in name of the Bala. Some place under
Yes,
Pavonia
yes, sir.
odorata, Pavonia odorata. There are so many species which are being.
Yes, yes.
So that is the reason every time I told, if you want to use it in clinically, you just go and collect yourself. Don't rely on any other sources. Just rely on your own source.
Audiences joined late, so they wish to know about the features of all type of Bala. Sir, please explain once the features of all type of Bala.
No. See. All information is all photographs, pictures, videos. Everything is available internet and every source. There are so many sources, and I need not to explain. Just if they come to the field, I will show.
Okay, sir.
Without seeing personally, it is not possible to make them to identify a sure medicine, sure plant. It's not possible.